Now more than ever, people are recognizing that mental health and substance use disorders are health conditions and that we have an opportunity to really treat them as such. But I do think right now it's so important in Ohio because Governor DeWine has prioritized it for his administration. And that attention, that diligence, that mindset of really delivering on the promise that's been before us for decades but never implemented is something that is really driving us forward today.
So we actually have 3 independent teams that cover 4 counties now, and those teams consist of a crisis intervention specialist and a case manager. In our office we have a navigator. The navigator is actually kind of like the captain of that team, and they all 3 work together on whatever kind of crisis call there might be.
I do a lot of the connecting into different resources in the community. So I kind of guide people through all of that to get them established into some kind of treatment. If they don't have Medicaid or anything along those lines, I walk them through the process. I'll either be on the computer with them, signing them up for it, or on the phone with them.
A lot of times, some of the barriers that are out there might be something as simple as transportation. So if somebody can't find their way to an appointment, we find a way for them. If somebody needs something like a basic need, food or shelter or whatever the case might be, we find it. If public safety calls and says, I have someone in crisis, we're coming. We have multiple different agencies that will call us and say, I need help, and we're coming. So we don't actually ride with law enforcement. A dispatch center might get a phone call or a 911 call for a crisis. And when they receive that call, if they recognize it to be a mental health or addiction related call or something that we could help on, they will actually call us and dispatch us to that scene. So then our teams will actually arrive and work with public safety. We more or less collaborate together to figure out what needs to happen. We work very well hand in hand with public safety in trying to figure out what's the best way to affect change for this person.
One of the great things about Ohio is the strength and power of our local communities. And we work very diligently to make sure that there's resources and planning opportunities for every community in Ohio to build on those assets that they already have and to close the gaps they need for their local citizens.
The whole idea behind the development of this program was to fill the gaps that existed.
So we have noticed quite a few people that we have calls on, they're not calling 911 so much, they're calling us. And we are able to de-escalate those people on the phone or have the team go out and try to see what we can do.
And it's obviously a work in progress every day, but to get to this point and to hear how well they're doing is just amazing to me. I couldn't even begin to tell you how many different lives that we've been able to affect change with. It's been a great thing.